Spine surgery in particular is very unique and has very specific risk factors that are different than our general risk factors of our usual pain, infection, and bleeding that we discuss with patients when they have a general anesthesia for other surgeries. Most common risk factors we deal with in spine surgery are infection. The infection rate depends on the patient's status, health status overall. A patient that is diabetic and overweight has a higher chance for infection than somebody who's healthy with low risk factors. The bigger the operation and incision, the more risk for infection. Fortunately, today's day and age, we do most of our surgeries less invasive, without as much exposure, oftentimes with tubes and small incisions, so that risk factor is decreased quite a bit. Anytime we do a spinal surgery, there's always some slight chance for neurologic injury, including injury of a nerve root, which might be a specific nerve going to an arm or leg, or even the spinal cord itself. Fortunately, those risks are very rare, but anytime a surgery is performed, there is some risk that entails. Anytime we do direct work around the nerves themselves and the sac that holds the spinal fluid, there's always a slight chance for a leak of spinal fluid that can happen inadvertently, particularly when releasing scar tissue around a nerve. If that were to happen, the surgeon usually will repair the leak and place you at bed rest for 1 or 2 days, and it should have no long-term consequence for your overall outcome. When we do anterior surgery on the lumbar spine, there are specific risk factors that we don't have with other surgeries. When we do our O-lift procedure, there's some risk for anterior thigh pain on that left side, which is fairly common after the operation and usually resolves in a few days. We also have risk for blood vessel injury when we work around the aorta and vena cava, particularly with L5-S1 surgery when we come anteriorly. That risk is low, but sometimes can lead to a fair amount of blood loss if an inadvertent vessel injury occurs. When we do surgery that has any risk for blood vessel injury, we usually incorporate an access surgeon, and in our case, Dr. Wassell, who's been doing surgery with us for over 20 years and has extensive experience with anterior exposures. Anytime we do surgeries on both the neck and the low back, there's always a chance for inadvertent nerve dysfunction after the surgery. There are 2 nerves in particular in spine surgery that are more sensitive than the other nerves, and they both have a 5 in them. The C5 nerve, which supplies the deltoid muscle, and the L5 nerve, which is what causes a foot drop, can sometimes have either a stretch injury or just be very sensitive from working around the nerve during surgery. When a foot drop occurs, or a shoulder drop, or the deltoid weakness occurs, the good news is most of the time the weakness will resolve almost completely 90% of the time. One other risk factor with spine surgery, particularly when the patient is prone on the operating table, i.e. upside down, face down, is that when the patients are in surgery for a long period of time, there's a risk for blindness. This was 1 in 10,000 20 years ago, and this was at a time period when spine surgery sometimes took 8 hours or more with the patient in a prone position. Fortunately today we have better positioning techniques, better operating room tables, and we don't operate with cases that take such a long time. So that risk for blindness is relatively low, but there is still a slight chance for blindness in a patient that's prone position for a long period of time. Risk factors for those patients are usually older in age, and diabetes and blood vessel disease are the most common risk factors in patients in retrospective view who've developed blindness after a spine operation. Overall, these spine risk factors are very rare, but it's just important to know that these are things that could happen and there's ways to treat them, and most of these problems do resolve without incident.